Dr. De La Cruz, could you describe a mastectomy?
So there are different types of mastectomies. So I'm going to start from something called a simple mastectomy. So a simple mastectomy, also known as skin sparing mastectomy, is essentially the removal of 98% of your breast tissue, but also the nipple areolar complex and skin around that area. Usually, this is done for patients who cannot preserve their nipple areolar complex. This is done by essentially an ellipse excision of the area around the nipple areolar complex where patients end up with a linear scar across their chest. The second option for mastectomy is a nipple-sparing mastectomy. A nipple-sparing mastectomy is essentially the removal of 98% of your breast tissue, but we preserve the skin, the nipple, and the areola. These can be done using two incisions. The most common, at least in our surgical practice, is a inframammary fold incision. There are some institutions that do a periareolar incision, so something around the areola, almost like half a lollipop look that happens above the areola and towards the lateral portion of the breast. And in our institution, in patients who undergo nipple-sparing mastectomy, can have also the reconstruction at the same time, just like the skin-sparing mastectomy. A third type of mastectomy is essentially a modified radical mastectomy. And those are for patients with locally advanced disease, like inflammatory breast cancer, patients who have a lot of disease burden in the axilla, and patients who have involvement of the chest wall or the skin. And in those cases, we remove skin, we remove the nipple areolar complex, and we remove 10 to 20 lymph nodes underneath the armpit. And in those patients, again, some of them are candidates for reconstruction, but if patients have inflammatory breast cancer, they will not be a candidate for immediate reconstruction. Those patients usually have to wait about a year after the completion of treatment, which includes radiation and chemo, to then undergo reconstruction.